Hi everyone, Dr. Chelsea here from Treasure Valley Pelvic Health. Did you know that April is Cesarean Awareness Month? Well, today I wanted to talk about things you can do to prepare for your upcoming cesarean, or even if you're pregnant and not planning a cesarean, but really want to be prepared for any possible outcome. So keep watching and let's learn. If this is your first time joining me, I am a pelvic health expert and energy medicine practitioner. Now, I routinely work with women during a pregnancy and after a pregnancy, so it's always interesting to hear the stories that women have of what their anticipated births are and what the actual outcomes end up being. And it can be very unsettling to a woman when a birth doesn't go as planned. So, I'm going to cover some key things to consider to try and prepare yourself for a possible cesarean or a planned cesarean, as well as things to make sure you understand about the recovery process through a cesarean. Now, regardless of the mode of birth, staying healthy and doing regular exercise throughout a pregnancy will always help with the recovery process. This is even more so true anytime there's surgery involved, which doing a cesarean is a major abdominal surgery. So, even more important to stay healthy and do regular exercise through your pregnancy. Planned surgery, there's some things you can do to prepare for more optimal outcomes and minimize some of the side effects from the anesthesia. Some providers will allow you to continue to drink clear fluids up until about 2 hours before surgery, typically about the time that you end up heading to the hospital. If this is true, ask your provider if they're comfortable with you drinking a carbohydrate-based drink, typically more of a sugary-based drink. This sugar, carbohydrate, will help minimize a hyperglycemic effect that is very common after anesthesia. If the body shifts to a hyperglycemic state, meaning higher blood sugar, then it can really impact and slow the recovery process, which is going to just create more of a stress response in the body and can really impact your overall recovery. Now, whether you are planning a cesarean or this is a first time delivery and you just don't know what to expect, I think it's important to understand what all possible outcomes may be. So, talk to your provider what they would do in order to make a cesarean memorable, whether again it's planned or unplanned. Because should it be unplanned, at least you know that your provider is going to do the very best they can to make it as memorable of an experience as possible for you, which is such an important piece to that birthing process to the mom. Then, especially if you can plan for a cesarean, ask your provider about a family friendly cesarean. Now, more and more providers are starting to embrace this approach, but it's super important and can really minimize the clinical setting of a hospital delivery in this nature. Now, during that conversation of how that provider might be able to make that a more memorable cesarean for you, you might ask them if they are familiar with or practice more family-friendly cesareans. Not many providers are doing this these days, though more and more are starting to embrace this approach. And this can be utilized for a planned or unplanned cesarean as long as it's not an emergency situation. Now, in a family-friendly cesarean, they lower the drape so that you have a little bit more visibility and it doesn't seem like you're just in the operating room, so that you can see and experience a little bit more of the true delivery of the baby. With that, they will also deliver the baby a little bit slower instead of just quickly removing the baby, clamping the umbilical cord, and moving on to closure once they remove the placenta. They really try and slow the process down so it seems a little bit more organic, a little bit more natural, and a little less traumatic to the body. Also, you can practice delayed cord clamping and really take that golden hour to connect and nurse with the baby during closure in the operating room. Again, this can be a little bit more challenging and not the option available in emergent situations. But if it's not an emergency situation, then it can be a great option and really create such a more memorable experience for you and your partner. Along those same lines, make sure and discuss with your provider what your birth preferences are, such as delayed cord clamping and immediate breastfeeding, and that golden hour of uninterrupted time with your baby, so that should it shift to a cesarean, if this is an unplanned cesarean for you, that at least they can be able to try and facilitate those sort of experiences for you through this journey. Now, this next piece is easier said than done, but still such a powerful piece. Now, keep in mind that birth is birth. It's not the circumstance of the birth, it's more of the internal awareness that you have and how you perceive that experience that really creates it your birth story. The mindfulness awareness of the sacredness of bringing a new life into the world can really shape your experience to be just as beautiful and transformational as a vaginal birth. Now, many times I see women come into my clinic who really want to try for a vaginal delivery after having a cesarean with their first, or also known as a VBAC, vaginal birth after cesarean. Keep in mind that that can be really empowering and create a sense of success and achievement for that woman, but it can also create more grief because if things again don't go as they hope and plan and dream and work so hard, it can really reinforce and create even bigger trauma into that psyche. So you have to have that awareness of when to pull back and when is it going to be better for you and your baby to have more of a calm, peaceful experience, such as a family-friendly cesarean, versus trying just to be able to check that box to say that you've had a vaginal birth. Again, much easier said than done, but if you can have your provider, your birth partner, your doula, whoever your birth team is, have this conversation so that they know what those signs are of stress for you, that they might be able to suggest shifting over to cesarean, and at least you can be mentally prepared and have that as an option on the table, though you might really want a VBAC. Now, the recovery. It's really important to understand that the recovery process for a cesarean is quite different than that from a vaginal delivery. It's going to take a little bit longer. It is a major abdominal surgery after all, and you need to be on top of those pain meds, especially for that first week. It's much more difficult to bring the pain levels down if we allow them to really escalate, then try and use any sort of pain medication that the providers have provided to us, versus really trying to stay on top of it as prescribed for those first few days. I know many women don't want to take those pain medications because of breastfeeding and any possible side effects that they may cause to their body, but some sort of pain reliever is really going to help allow that body to heal and minimize that stress response in the body so that you can heal a little bit more quicker and a little bit more efficiently. Now, it's no secret that birth is challenging and it's okay to grieve. Birth in itself can create grief, whether it be a vaginal delivery or a cesarean. It's really when our expectations of what is going to happen aren't met and the experience is different than what we are anticipating and hoping for. I often find that women who have a cesarean on their first birth, when they're really hopeful for an unmedicated birth, that they have more residual grief behind it because they aren't allowing themselves to fully recognize their emotions and the experience that they were either missing out on and that they actually experienced. If we don't allow ourselves to fully grieve and process those emotions, it can really set us up for more challenging experience, not only in that immediate postpartum period, but throughout a lifespan. So whether you need to lean on a mental health professional, your birth provider, a doula, or your friend or family, really lean into each other and find a support group or a support system to allow yourself to process that grief. It doesn't have to be traumatic. Society really labels big experiences that are kind of ugly as traumatic, but really it's when things go awry that for that individual that may perceive it as traumatic. And it's okay to recognize that. So know that birth can be empowering for all women as long as we allow ourselves to process that grief. It's important to know that we can really heal our soul and it takes time, But if you lean into those people and into your support group, it can really end up to be a really beautiful experience. There are many cesarean support groups, whether it be on Facebook or local face-to-face groups. And so I really encourage people to reach out to your local community and see what you can find to help you through this journey, to help you find other women who had similar experiences. Because so many times and too often, I hear women say that they feel like this is their journey and that they are alone on it, and they've never heard people talk about their experiences. And when I tell them that I've heard this over and over again, they just start to break down. So reach out to each other, really find a network of women to help raise you up when you're really struggling, and know that at some time you will be able to extend that hand and help someone else through their journey too. I'm always a fan of utilizing Reiki as a natural method for healing the emotional side of it, as it is a Japanese form of relaxation that helps optimize the natural healing method of our bodies. And this can help just allow the energetic flow through the body to be a little bit more efficient, and again, allow those natural healing processes to occur. So find a local Reiki provider who can help practice that healing method and maybe allow your postpartum journey to be a little bit more efficient. Now, another piece that is highly overlooked after having a cesarean is scar massage. Time and time again, I find that women, even decades later, are starting to experience problems associated from restrictions in their scar tissue and from that scar wherever they had a cesarean. If they had spent some adequate time doing some scar massage earlier on and more consistently in that recovery process, then it's highly likely that they would minimize any sort of problems to their bladder, to their low back, or even pain with deeper penetration. So really take some time and learn how to do scar massage. Now, I have another video that takes you exactly through what to do, or always reach out to me and I will be more than happy to guide you. Another consideration after having a cesarean is that the abdominal wall is weakened even further because it has been cut through. Think about it. All muscles in that abdominal wall had to be cut through in order to get down to the uterus. And anytime a muscle is cut through from surgery, there creates an inhibitory response. And so the muscles can take some time and effort to really be re-woken up in order to provide that sufficient support as it should be in the body. So you have to really take some time and effort to have targeted strengthening. This is true regardless of a pregnancy outcome, of if it's a vaginal delivery or a cesarean, but I find more often than not that women who had a cesarean have just that much more of a weakness in their core and really truly need that targeted strengthening that much more. Now, a huge misunderstanding from women who experience a cesarean delivery and just society as a whole is that they are avoiding any sort of pelvic floor problems because they didn't have to deliver vaginally. And this could be further from the truth. It's not actually the vaginal delivery that creates all of the complications and trauma to the tissues, though it does create some naturally. However, there can be quite a bit of pelvic floor dysfunction simply from carrying a pregnancy. Think about it. You have the extra weight, you have the extra hormones that create more laxity. So there's a natural weakening effect if the muscles aren't targeted and strengthened throughout a pregnancy. So those women who experience a cesarean delivery do still experience pelvic floor problems such as incontinence, pain with penetration, prolapse, and many other things. Now, there are many great things about a vaginal birth, but again, just a reminder that at the end of the day, birth is birth. The mode of the delivery pales in comparison to the fact that you were the individual that created this human being. So embrace that, because only truly you can birth that baby. So I hope you found this information helpful. And if you have any questions, put them in the comments below. Otherwise, I wish you guys happy healing and a smooth journey into motherhood.